I want to talk about a case that involves multiple different factors, from color of teeth, shape of teeth, and balance from left to right. This case that we're looking at has a lot of different variables in here. First and foremost, what we look at immediately is the color of this tooth. Obviously, the most important thing is that the teeth are all the same color and shape. The other thing is we have two peg laterals, which have composite buildups on both of these teeth. And then lastly is the position of the tissue. So you see that this canine tucks underneath the lip over here, whereas these tissues on the right side are below. So obviously we have to upright the right side of the tissue and change the colors and dominance of some of the teeth. If I had to say what's my favorite position of the teeth in this mouth, it would definitely be these two teeth. But here you see this tooth is tucked in behind both of the canines and the centrals, and so also there's an imbalance in the position of the edges. Obviously we like the lateral to be a little bit shorter than the centrals and the canines, but in this case it's overly dramatic. So what do we have to do to correct these things? The most important thing is communication between the ceramist and myself in order to mask out the colors on the porcelain. So I want to show you what the porcelain looks like on the stone model and how, prior to even putting the case into the patient's mouth, we analyze it on the model. So here you're able to see and appreciate that we corrected the position of the tissue. Obviously we changed the lengths of these laterals, the dominance, and the color of these two centrals looks absolutely beautiful and will look even better in the real smile. So I want to show you from the back what this smile looks like, where the natural teeth are actually all still intact. This is all natural tooth structure. The veneer essentially just goes over like a contact lens over the front surface and wraps around ever so slightly around the edge to create the illusion that the entire tooth is covered with porcelain veneers, but truly it's only the front aspect. So it's a minimally invasive case, and this leads to amazing outcomes, long-term predictable results that will last many years down the road for the patient as long as the oral hygiene is maintained. So let's go into what that looks like. The color of these two teeth match perfectly. The position of the edges now goes with the shape of the lower lip. These laterals are now not so small and tucked back, and we can see that here where we look at that rolling position of the front teeth going into the lateral and into the canine as well. So now everything goes in line with how it used to. So I want to show a larger projection of the smile without showing too much of the face. Obviously, here's what we started with. This side was a little bit depressed. These colors and shapes were off. This is how we finished off with a feminine, confident, beautiful smile.